Welcome to the American Academy of Grief Counseling's video on Rogerian therapy and depression. And in this short video, we're going to look at how the humanistic-based therapy of Carl Rogers is utilized in treating individuals who are experiencing grief or, in fact, depression itself. So Rogerian therapy was developed by Carl Rogers as an opposition or contrast to psychodynamic approaches. This type of humanistic approach emphasized empathy and helping the person heal. It is more of a client-centered focus on the emotion that is present within the individual. The client is importantly seen not as sick or damaged, but as an individual looking to heal. So the process of Rogerian therapy is to help transform the client through this particular healing. Self-actualization is a term that Carl Rogers used that is key to this. It's where one wants to be. So if someone is sick, they want to be healthy. So through self-actualization, we try to reach that. So individuals naturally have a self-image of what they perceive. We'll refer to that as subjective. There is the real image, which is seen by others and actually exists. We'll call that the objective self as well. And then the ideal image, what is not achieved yet, what one would like to have in itself. Carl Rogers wanted to help individuals discover through this type of therapy what their self-image is, to thoroughly discuss it with the client, and then to help them through empathy see the real image, and through empathy again, give them the tools and skills they need to reach that ideal image. And he referred to the term as congruence when that idea of one's self-image and the real image are properly balanced within themselves. So helping the depressed function again through Rogerian basically falls upon an empathetic, patient-centered approach. No judgment within the counseling room, as well as a series of sessions that include empathetic listening, observation, and empathetic responses. These responses are return to the actual client what they are feeling. But it's important when these emotions are expressed by the client that the counselor does not label it something totally different. So it's important for the response to not parrot, but in a way mimic how the individual feels, to then begin to discuss maybe it is this feeling or potentially a different feeling. But the key is to help the client understand the emotion through labeling, sometimes in their terms. So in depression, I think it's especially important to empathetically help the client see one's true self. In depression, obviously, there is a cloud of doubt that is thrown over someone's self-esteem. And when one's self-esteem is struggling, then one really can't see the proper balance and how one is seen in the real world. So part of the Rogerian therapy in depression is to help the individual see the real self as opposed to the self that they are imagining. And I think that can take time, but through a very safe setting in the counseling session, one can begin to unfold and unravel this. So depressed individuals have a hard time seeing this healthy self-image. They are unable to function. They're in intense emotional pain, whether it's caused chemically or there is an acute purpose or a targeted loss that has caused this. They are grieving individuals and they are unable to function properly. They are unable to participate in society. They have lost interest in life. So it's important through empathetic care to guide this individual to their real self and the ideal self. And sometimes that ideal self is, what would you like to see yourself doing in the future? When an individual starts to function at a healthy percentage, Rogers lists 5 qualities that are important to look at. And there are also 5 goals, not just qualities of the healthy person or an individual client, but 5 goals that grief counselors really should look for to help the individual come out of this depression, this loss. Number 1, according to Carl Rogers, is the person is open to new experiences. An individual is not closed to doing something new. Their self-esteem is improved and they're willing to explore. Number 2, existential living, where the person is living in the present. We see many who are experiencing intense grief, or in other cases, depression, which is far worse, a grief that doesn't allow them to live in the present. They're not able to enjoy things that are right before them, the beauty before their eyes. Instead, they're trapped in the past. So existential living is critical, according to Carl Rogers. Number 3, the person trusts one's feeling and decisions. Those in depression have a very low self-image of themselves. So they have constant doubt. Should I have said that? Did I offend this person? Did I do the right thing? They do not have the confidence necessary to proceed. Number 4, creativity without fear of rejection of one's ideas. So that creativity, it comes from self-esteem, a good self-esteem. And they're not fearful. They're confident in their creations. Well, obviously, someone who's grieving or depressed is not able to do so. And finally, Carl Rogers listed the person can find satisfaction and fullness in life's decisions. They're able to create a new narrative. They're able to move forward. They're able to know where they're going, what they want, and the decisions, and find a contentment, at least, within that. So these are 5 things that, according to Carl Rogers, is part of healthy functioning. And I think most of us would agree that depression takes that away. So Rogerian therapy looks to help individuals find their real self, to find that ideal self, which is, ironically, a healthy, functioning person. And this involves empathetic listening, observing, responding, and also helping the individual transform through a series of sessions itself. Below is our grief counseling certification, as well as a link to our behavioral health certifications. Our number is 330-652-7776, and our email is info@aihcp.org. Please subscribe to our YouTube channel, as well as give this video a like. I'd like to thank you for listening in the meantime, and have a good day.